Hello, Daisy. So just before leaving today, since we're discharging you, we're just going to go over one of your medications you're going home with today. It's called Gentamycin. So, Daisy, the generic name of the medication is going to be Gentamycin. The brand name that you might see is called Gentamycin. So just depending on whichever one you see, that's one of the options on the prescription label that you receive. You're taking this medication because it's going to be to help treat a bacterial infection. It helps to work really well with any sort of infection that's inside the blood, urinary tract, lungs, or abdomen. Gentamycin is an aminoglycoside antibiotic, and so what that does is it inhibits the bacterial cell from protein synthesis, from duplicating and creating more inside the body. So this type of medication is commonly going to be given with either IVs, common in a hospital setting, or it's going to be given in an injection form. We can definitely go over how to administer that properly in the home setting once we get the supplies as well. So for this medication, there's not really any strict way for you to take it. You don't necessarily have to take it with food since it's not an oral medication, but just make sure to follow the label of how to take the medication properly and when to take it. And if you have any questions, you can always call or ask your primary care provider. So gentamicin, because of the way that it's excreted from the body system, we definitely will want to make sure to have you come in regularly for some lab results regarding your renal function, hearing, and liver function as well, and blood levels. And then if you're still under monitoring, depending on any other medications or the circumstances by the provider, we'll also make sure to monitor your vitals and your urinary output as well. Some common possible side effects, like mentioned previously, so for that, sometimes ringing in the ears or any hearing changes, loss of balance, and loss of urinary function, urination. So due to these adverse effects, it's really important to know when you should or shouldn't go to a urgent care or contact your primary care provider. One of those is going to be any sudden drastic changes in your hearing or hearing loss. If you're experiencing any little or to no urination as well, or any dizziness, confusion, and of course, like any other medication, if you're experiencing any sort of anaphylaxis such as rash, difficulty breathing, swelling, any sort of reaction. Do you have any questions in regards to the medication we're sending home with you? Again, it's called Gentamycin. Do you have any questions, concerns? We just want to make sure that taking this medication home with you today, that you feel very safe and confident using it. And then of course, we'll go over how to administer it properly with any injection technique. Other than that though, do you have any questions?